सुनील सर, ये सुशांत सर क्लास ले रहे हैं,
शुरू नहीं हो रही।
कुछ दिक्कत आ रही है, शुरू नहीं हो रही। अच्छा लाइव।
Hi, afternoon friends, afternoon everybody bache, afternoon everybody. I guess we know each other pretty well. I am Dr. Sushant Soni, MBBS MAMC, MD Pathology, Resident Hemato-Oncology, AIMS Delhi. So let's start with our MDS INI recall session for Pathology and Microbiology. Now just give me a thumbs up or just tell me that the session is working so that I know that everything is smooth. Yes, perfect it is. So let's have a look at the questions which have been asked. It was a very simple straightforward paper, and I know with respect to the medical subjects, देखो बच्चे, dental subjects always get you to a level, especially with respect to the NEET MDS exam. Dental subjects will get to a level. What will get you the top ranks are the medical subjects. This is with respect to the NEET exam versus the INI exam in the dental segment, in which dental subjects always play the major role. The number of questions from medical subjects are on the lesser side and the questions are straightforward. So I guess with the extreme pride, I can safely say that we had a 100% strike rate for both pathology and microbiology. The questions that were asked in these two subjects were simple and straightforward. Let's have a look at this. Starting with our first question, that is anti-nuclear antibody test. ANA is used for simple and straightforward SLE. We'll be having a look at this when we study immunity. We will see the presence of a young female, age group late 20s, early 30s, presenting with butterfly-like rash, malar rash, discoid rash and photosensitivity. Which antibody is present? ANA, anti-nuclear antibody. Then we will also have a look at a very important slide of antibodies of SLE. The most common or the most sensitive antibody is ANA, anti-nuclear antibody, versus most specific. देखो, most common में तो there is no confusion at all. Confusion occurs in specific. S for specific, S for Smith, that is anti-Smith or anti-SM, anti-Smith antibody, followed by anti-double stranded DNA, followed by anti-dsDNA antibody, most specific. Next is drug-induced lupus, which is associated with anti-histone antibody. Drug-induced lupus, anti-histone antibody. And lastly is neonatal lupus with congenital heart block, that is anti-Rho/LA, also called as anti-SSA/SSB antibodies. In the chapter immunity, this is going to be one of my favorite slides. So for the students who have joined slightly late, which is our first question, anti-nuclear antibody is seen in SLE. Next question, opsonins, which help in attachment of phagocyte to bacteria is. So in the chapter inflammation, we will be taking care of three basic points: chemotactic agents, opsonization agents, and the role of cytokines. So opsonization agents were asked, which complement protein? C3b. Other opsonization agents are Fc fragment of IgG, C3b, Fc fragment of IgG. Mannose. What is present on the bacterial cell wall? Mannose. Bacterial cell wall has mannose on it, which makes the bacteria tasty for phagocytosis. Mannose. CRP, C-reactive protein, CRP and fibrinogen. These are our opsonization agents. Versus C5a, which is a chemotactic agent. Please do not go wrong in this point again. C3b is an opsonization agent versus C5a, which is a chemotactic agent. Next question. I want you guys to answer this. See, this is a very live interactive session, so please do write it in the chat box. Abnormal folding of proteins is seen in which of the following conditions? That is, it is associated with prion diseases. Abnormal folding of proteins, and which is the most common prion disease? That is the Creutzfeldt-Jakob disease. Creutzfeldt-Jakob, plain and simple. Next question. Now, this was the same question which was asked in the NEET PG segment, that is in the MBBS segment, NEET PG segment 2019. Now, in a patient, if there is no CD40 receptor on B cells, absence of CD40 receptor on B cells makes it as a case of hyper IgM syndrome, that is why doing the NEET PG medical questions also becomes extremely important for the dental segment. When we will be having our routine classes of both pathology and microbiology, we'll be having a look at those questions, of course. So absence of CD40 receptors on B cells makes it as hyper IgM syndrome. Hyper IgM syndrome, the name tells you IgM antibody बहुत ज़्यादा बढ़ी हुई है. IgM antibody is massively increased. Why? Because there is a defect in immunoglobulin class switching, as a result of which there is inability to produce IgG, IgA and IgE. This was the answer to be marked in this question. Inability to produce IgG, IgA and IgE, which is a feature of hyper IgM syndrome associated with absence of CD40 on B cells. Next question. The causative organism. Causative organism for acute herpetic gingivostomatitis is, with respect to herpes, we follow a simple rule in microbiology. HSV1 is above the waist, HSV2 is below the waist. So HSV1, which it is associated with gingivostomatitis, the most common site of which is buccal mucosa, whereas the most common recurrent lesion occurring, that is why, is herpes labialis. So differentiate between the questions. Above the waist, HSV1. So gingivostomatitis, most common site, buccal mucosa, HSV1. Versus below the waist, that is HSV2, which is associated with genital herpes. That is, it affects the penis, urethra, cervix, vulva and vagina, along with neonatal herpes. That is why, to prevent neonatal herpes, cesarean sections are performed and aseptic meningitis. We'll be seeing this in the full sessions. So above waist HSV1, below waist HSV2. Next question. Again a repeat previous year question, infectious mononucleosis, which is associated with Epstein-Barr virus. So which is the questions actually tell you the importance of two things. The previous year questions, both of the MBBS NEET PG segment and of course the dental segment, and revision. Two revisions which are most important for success. When we are doing the full course, that is, you will be studying it along with the faculty, along with the subject, that is 0. We will be finishing the syllabus maximum by first week of September. After that, between September and your NEET PG exam, 2 revisions. Do this and you will be 100% passing the exam and getting a government clinical seat, no doubt about it. So infectious mononucleosis, a repeat PYQ associated with Epstein-Barr virus. So let me actually rephrase this. Epstein-Barr virus, other than infectious mononucleosis, is associated with Hodgkin's lymphoma. Which is the most common Hodgkin's lymphoma with EBV? Mixed LRT. Mixed LRT type of Hodgkin's. Next, it is associated with non-Hodgkin's lymphoma. Which is the most common non-Hodgkin's lymphoma with EBV? Burkitt's lymphoma. It is associated with Burkitt's lymphoma. And infectious mononucleosis, also called as the kissing disease or glandular fever. So, of course, if it is the kissing disease, it is spread by the respiratory route. It is an acute self-limiting disease. Need not worry too much about it. Seen in children and young adults. Clinically associated with fever, sore throat and cervical lymphadenopathy. This is infectious mononucleosis associated with Epstein-Barr virus. Next question. Critical care units often cause hospital-acquired infections in patients. Now, the nosocomial infections, they are defined as infections that a patient contracts that a patient contracts after 48 hours of stay in the hospital. A patient developing an infection after 48 hours of stay till 30 days. What is the other limit? Till 30 days while receiving healthcare that was not present at the time of infection is called as nosocomial infection. This is the definition of nosocomial infection. Infection occurring after 48 hours till 30 days. Till 30 days, not the infection not being present at the time of admission. Next, endotoxin is present on cell membrane of which of these pathogens? Straightforward question. All of us know that endotoxins are secreted by lipopolysaccharides which are present on gram-negative bacteria. Now my question to you is, which is the only gram-positive bacteria also associated with secretion of endotoxins? This is the only exception, but it is associated with listeria. Endotoxins, they are secreted by listeria also, which is a gram-positive bacteria. So still in this question, the best answer will be B. That is, endotoxins are secreted by gram-negative bacteria. Please don't go for both. The best answer in this case is B. B for Bombay. B. Next question. Next and lastly, beta hemolytic streptococci, as per the Lancefield classification, but they are classified into A to J, A to J except I. So our answer is A, B, C, D, E, F, G, H. I and J are not there. So let us have a look at the classification of Streptococcus. On the basis of oxygen requirement, I can classify Streptococcus into aerobic or facultative aerobes versus anaerobic. Anaerobic is the Peptostreptococcus, not much concerned. Aerobic Streptococci, on the basis of blood agar, hemolysis on blood agar, are of three types. Alpha hemolysis, that is partial hemolysis, beta hemolysis, complete hemolysis, and gamma is no hemolysis. Alpha, beta, and gamma hemolysis. Beta hemolytic streptococci, that is the ones showing complete hemolysis, are further divided by Lancefield classification. Lancefield, the name itself tells you it has a C in it. So Lancefield classification is based on carbohydrate C in cell wall. It is divided into subtypes A to V except I and J. That was asked, which is further divided by Griffith typing into group A, B, and D streptococci. Not concerned. So in our case, beta hemolytic streptococci, as per the Lancefield classification, is A to V except I and J. I and J should not be there. So these three options become wrong, and the answer was 1. So this was with respect to the pathology and microbiology recall questions. Do tell me in the comment box how the paper was, how you felt with respect to the questions, and in case you have any queries whatsoever, but you feel comfortable to write it in the chat box, in the comment box, or send it to us on Telegram. Needless to say, we are in this together, firstly, and from the bottom of my heart, may your result be much better than you expected. So take care. We are available on Facebook as well as Telegram. Thank you.